Hello viewers, welcome to our channel JD Pharmacoveda. In this pharmacology classification section, let's discuss adrenergic and anti-adrenergic drugs. So first of all, adrenergic drugs. So adrenergic drugs are the drugs which act on the specific alpha and beta receptor, particularly the catecholamines like adrenaline, noradrenaline and dopamine. Okay, so in this classification, the adrenergic drugs are otherwise known as sympathomimetic drugs, and likewise the anti-adrenergic drugs are also known as sympatholytic drugs. In adrenergic drugs, the first classification is pressor agents. So pressor agents means the substances which increases the blood pressure. So which vasoconstrict the blood vessels and it produces or increases the blood pressure. So the drugs are noradrenaline, ephedrine, dopamine, phenylephrine, methoxamine, mephedramine. Then next category is cardiac stimulants. The drugs are adrenaline, isoprenaline, dobutamine. Then bronchodilators. So these drugs can dilate the bronchial smooth muscles. So the drugs are isoprenaline, salbutamol, terbutaline, salmeterol, formoterol, bambuterol. Then next category is nasal decongestants. So nasal decongestant are the agents which unblock or open the blockages in the nasal cavity. So the drugs are cyclometazoline, oxymetazoline, nafazoline, phenylephrine and pseudoephedrine. Then next category is CNS stimulants. So CNS stimulant drugs are amphetamine, dexamphetamine, methamphetamine, methylphenidate. Then next category is anorectics. So these anorectics are agents which increases the ability to take food intake, likewise it activates the hunger site. So the drugs are amphetamine, fenfluramine, sibutramine. Then the last category is uterine relaxants, so which relaxes the uterine muscles. So drugs are ritodrine, isosoprine, salbutamol and terbutaline. In the next category is the anti-adrenergic drugs. So we classify this into two broader classes, alpha blockers and beta blockers. So first, alpha blockers. So which are the alpha receptors present mostly in the blood vessels. So it has two types, non-equilibrium and equilibrium. In non-equilibrium type, the drug is phenoxybenzamine. So it comes under beta haloalkylamine. Then the equilibrium type, it has non-selective, alpha 1 selective and alpha 2 selective. In non-selective, the drugs ergot alkaloids are ergotamine, ergotoxin. Next drug is hydrogenated ergot alkaloid drugs are dihydroergotamine, dihydroergotoxin. Then the imidazoline drugs are phentolamine. In this category, the miscellaneous is chlorpromazine. So then the alpha 1 selective drugs are prazosin, terazosin, doxazosin, alfuzosin, tamsulosin, silodosin. And the alpha 2 selective drug is yohimbine. Then other category is beta blocking agents. Here also it contains non-selective and cardioselective drugs. So in non-selective, the first category is without ISA. ISA means intrinsic sympathomimetic activity. These drugs can produce or stimulate and which can inhibit at the same receptor. This category is ISA. So without ISA, the drugs are propranolol, sotalol, timolol. And with ISA, the drugs are pintolol. With additional alpha blocking property, the drugs are labetalol and carvedilol. And particularly the cardioselective or the beta 1 selective blockers are metoprolol, atenolol, acebutolol, bisoprolol, esmolol, betoxolol, celiprolol and nebivolol. So thank you for watching. If you like our video, please like, enter your thoughts, doubts in our comment section, share with your friends and subscribe to our channel.